Imdad, Managing Director of Grameen Healthcare Services. Sir, if you can have, oh, there you go. Perfect.
Okay.
We have access. Hello, sir. How are you? It's nice to meet you again. Without further ado, please start your session. Thank you.
Okay. Can I have the access to my screen, please?
I think you do have access. You can just try it out with the middle button.
It's not working actually. Aziz, do you have my one?
You have a screen share, sir. You can just click the screen share. You have the permission.
Yeah, I put in the screen share. Just 1 second. Share.
There you go. Perfect.
I cannot have access to my screen.
I think we are seeing your screen, sir, right now.
But sorry, I'm not getting my screen share. Aziz, do you have my one, the presentation? It's not working. Windows. Okay, here you go. I guess I got it.
Perfect.
Okay, can you see that?
Yeah.
Okay. Ladies and gentlemen, good evening, and welcome from Grameen Healthcare Services Limited. Grameen Healthcare Services Limited is a social business enterprise, and it was actually established in 2006, initiated and inaugurated by Noble Laureate Professor Mohammad Yunus. 4 Grameen companies: Grameen Telecom Trust, Grameen Kollan, Grameen Shakti, and Grameen Telecom. These 4 companies actually invested with the objectives to make accessibility and availability and also affordable eye hospitals for the less privileged people. And all of our 4 hospitals are located out of Dhaka. First one is actually located in the Bogura districts, that was established in 2007. And second one is has started its operation in 2009. It's a Barishal district. Third one is in Thakurga. It's a district in northern Bengal. And the 4th one actually we started recently. It's a south, is located in one of the district of South Bengal. It's called Chowdhury. Actually, we started with our venture with the cooperation of our collaborative partners, the Orbind Eye Care System, Orbis, Sheva Foundation USA, later Fred Hollows Green Foundation USA, and Sightsaver joined with us in a joint collaboration. Our objective is to ensure quality healthcare services at affordable cost to the doorsteps of rural Bangladeshis, and that's why all our hospitals are located out of Dhaka. This is actually, I'm giving some updates, recent updates. Our 4th hospital, that is, as I mentioned, located in Chowdhury Hospital, started its operation during last year, during pandemic time, and it was inaugurated in September. And we started our eye operation from this year, March 2021. This year we have taken another initiative to establish small eye care center we call vision centers with the cooperation of Sheva Foundation USA. These are actually all satellite clinics that will give accessibility to the rural areas, people who are hard to reach and have less access to eye care services. And recently we opened as a subspecialty glaucoma. Glaucoma is, one of the disease which causes blindness, and one of our objectives is to eradicate unnecessary or needless blindness. So we opened one subspecialty department that's called glaucoma unit in Bogura this year in January 2021. We also expanded and renovated the OPD fast track services in Thakurga Hospital. You can see it's a spacious OPD area where more than 50 to 60 people can actually see, and there are 4 doctors are serving in this OPD services. Recently, we took initiative to modernize our hospitals so that less privileged people can get better healthcare services, better eye care. We bought fac machines, IOL master, operating microscope, and we are replaced with the old machineries to keep up the standard of the eye care. This is also actually is a typical one of the pictures of our cafeteria where the OPD patients and the visitors can have their snacks and tea, coffee during waiting time. We believe in training, continuous training, and we started a program with the village doctor regarding primary eye care, so that they can actually refer the patient to our base hospitals. Similar concept like our satellite clinic. These satellite clinics will also be run by optometrists, and they will do the primary screening, and they will refer the patients to our base hospitals, so that people can have better quality standard eye care surgeries and treatment. During pandemic time, actually we started a awareness program, and also very strict hand sanitization and hand wash. We created hand wash facilities at the entrance of the hospital, so that every visitor can have the hand sanitization or wash their hand before entering to the hospital. Also, we started using from the pandemic period, we started using personal protective equipments and keeping the social distancing to prevent and protect our doctors, nurses, and also patients from the spreading of corona pandemic. During the pandemic time last year, we also distributed food to the less privileged community, and we distributed masks as a part of our awareness program. We usually celebrate all health-related days. Like this year, we celebrated glaucoma week. We celebrated World Women's Day. We celebrated World Health Day. We celebrated the 12th anniversary of the Barishal Eye Hospitals and World Sight Day. This is the most important day we celebrated last year. And here are some of the photos of social commitment to poor patients and the surgery support for the poor patients. These are also some of the pictures of the training programs that we continuously providing to our nurses and teaching staff. We also started digital marketing, forestation, and also we started, beautification of through gardening. And all 4 hospitals has 230 beds and with 10 operation theaters. And total number of staff is 307. And our beneficiaries actually so far more than 2 million patients we served. And this is our way forward to start it, go for subspecialties, super specialties, and establishing more eye care facilities in the district level. Thank you. Any questions?
Thank you, Kishore. That was quite insightful. You guys covered a lot, actually. Unfortunately, we are out of time. We are out of the 7 minutes. So we will move on to the next presenter, Mr. Kazi Haq, CEO of Grameen India, and Mr. Narayan Sutarajan. So, sirs, if you could please go ahead. Thank you very much.
Hello, everyone. I hope everyone can see me and hear me. And I've also got Narayan on the conference as well. So good morning, good afternoon, good evening, everyone. We're going to talk about technology for social impact. And Grameen Intel has been around for a long time. And we wanted to first give a quick context on what the company does. But I will quickly dive into 2 or 3 specific products that we offer as a solution. So, we have spent over the last few years doing a lot of research and development, but at the end of the day, I think what we have are real concrete products that can be utilized. So let me just quickly start with the background here. 2 things I want to just highlight first. First, we do have a book. Okay, so all of you can read about my profile on the website. But what we have done is we've actually captured our real learnings from day one. from the day we started our business, and it's captured in this book called The Rule of One that I co-authored with Narayan Sundarajan, who's our Chief Technology Officer, and Jason Green, who's from the academic world. This is not a theoretical book. It is a real practitioner's guide, and we have our top 10 lessons learned. So it's available on Amazon. Absolutely take the time to read it if you're interested in starting up a social business. So this is really our insider story of our startup business from day one. Moving on, what is Grameen Intel? So first of all, we have rebranded ourselves. We call ourselves Technology for Social Impact. I think it really captures the true essence of our mission. It's about technology. It's about for social impact. And quickly, I think those of you who know Intel, we are known for the microprocessor. And the goal has always been to expand the billions of dollars we've spent on research and developing this really one of the most difficult products mankind has ever built, which gives you the power to surf the web, right? To use a laptop. And we wanted to extend that capability beyond to really benefit kind of the base of the pyramid for those who lack access to technology. The performance measures, like any other social business, is about social impact and sustainability. And obviously we have some work to do on that space. And the company is based in Bangladesh. I just want to give you a quick visual on what the environment looks like. Definitely, if you're in Dhaka, come visit us. We have a bunch of engineers who will be happy to take you around and show you the products and how we develop these products. So definitely come by if you're in Dhaka at any point in the future. Okay. So let's talk about two specific solutions. Like everybody else, we first anchored on the Sustainable Development Goals, right, from the UN. We thought it was a good framework in terms of how you talk about our technology. Our book is called Rule of One, and the reason why we called it that is because we always felt that you always start with one problem, come up with one solution, and start the walk in one village. Now, there are three areas here where we have applied that principle. Agriculture is one, healthcare is the other one, and the other one is the early learning. Today, I'm just going to show you some products we have developed by this company, by the social business, on the first two, which is the agriculture and healthcare. Okay. So let's start with the kind of the healthcare side. Again, what exactly is the problem we were trying to solve? And given the multitude of issues, I think the focus is key. And what you see here are two problem statements: maternal health, right, which is the one on the top right, and the other one is indoor air pollution. Let me quickly touch on each of those. Maternal health, as you know, it's about more preventive care, and you've kind of all seen the statistics. But the important thing, what we realize, is just the lack of information for a mother to take some preventive care for the child. That was one area. Then the question is, what do you do about it? The problem is pretty wide and broad. The other problem we've noticed is if you visit villages in Bangladesh, you find mothers cooking in some enclosed space, and they're inhaling things that come out from the burning of cow dung and wood. It generates carbon monoxide, and if you do kind of follow through some of the effects you see in a child, it really starts with that. Inhalation of carbon monoxide can really have detrimental effects on the brain and the growth of the child. So with those as a two problem statement, we asked ourselves, what would be some reasonable solutions? And I'm going to give you some example here of what we call this a magic bangle. There are two features that we have in this product, and we wanted to really make it beautiful so a mother in Bangladesh would actually wear it, would like to wear it, just like a bangle. It has a carbon monoxide detector, so it absolutely detects the level of carbon monoxide when a mother is in the kitchen. When it reaches a certain threshold, it gives an alert. On top of that, it also has pre-recorded message for maternal care. So every week she's getting a tip in terms of her pregnancy care. Battery life is about 10 months because we know what it takes, access to power and charging a bangle like this. So really beautiful product. It took us a long time. A lot of research went into it, and I'll give you some appreciation of what it really takes to create one of these products, right? If you open up the inside of the product, and this is where the engineering talent of Intel and Grameen kind of comes together, along with the feedback you get from the field. PCB is the printed circuit board, right? We all know a printed circuit board that's flat. What does it take to create a printed circuit board that's round, that goes around the bangle, right? When you think about the speaker that gives the tips to the mother, think about the speaker has to be porous, right? So the sound can come out. Think of the fact that there's some detection chips that needs to detect the level of carbon monoxide. So you need to make it porous. At the same time, you need to make it waterproof. This is high tech. A lot of thinking, a lot of thought process, a level of thoroughness in terms of the engineering work went into it. So this is our product. It's called Coil, and a lot of institutions are interested. The other thing I want to quickly touch on is agriculture, knowing we're out of time. In Bangladesh and many parts of the world, people over-apply fertilizer and they have subpar yields. What we have is a soil testing software where you take a sample of the soil, put it in a test tube, apply some chemicals, look at the reading, and just like a prescription, it gives you the optimal level of chemicals and fertilizers you got to use. Now, we don't expect a farmer to have one of these software, but we do expect an entrepreneur who can actually serve the community, who's educated, who can use the technology and serve the farmers for soil testing for 2 to 3 crop cycles a year. And the next version of the product is one of these small tablets that you can take to the field, the entrepreneur. The test tube goes, what you see on the top, you do the analysis, it gives you the optimal level of chemicals and fertilizers you need for your next crop cycle. The last point I wanted to make here is we are looking for micro entrepreneurs who can take our technology solutions and deploy it, create some small businesses. The thing I wanted to highlight here is going back to a book on Rule of One. It's a specific problem. It's a specific business solution with a clear social impact. Thank you.
That's fantastic, Azibhai. That was really an eye-opener. We had a couple of questions, although we're out of time. I'm going to give you 20 seconds to answer it. One of the respondents said, "Well done on the bangles." Another person said that, "Is it difficult to change the battery on the coil bangles? And do they know how to do it, or do they need a technician to change the batteries?"
It's a rechargeable battery. So you don't have to replace it. Now, just like any other business, we have to think about the cost benefit. It ends up being a little more expensive, as you all know, but it is a rechargeable battery. It does not require changing it.
Awesome. Sounds good. But thank you, gentlemen. That was quite insightful. Starting from Kishore Ahmed, Managing Director of Grameen Healthcare Services, sharing his insights on his institution, and then Mr. Kazi and Mr. Narayan throwing some light on those fantastic rural innovations. We really need those sort of tools and products out there in Bangladesh and all over Southeast Asia. Having said that, we move on to our next plenary session, the fourth and last one of the day, I believe. It's a very jam-packed, action-packed session, I must say. And the topic is it can't be as immediate and as urgent for these times. It's healthcare as a social business in the context of pandemic and the post-pandemic era. And as a moderator, we have our very favorite friend, Dr. Cam Donaldson. He's the Pro Vice Chancellor for Research and the Yunus Chair in Social Business and Health, all the way from Glasgow Caledonian University. Dr. Cam, it's great to be here with you. It's quite an honor. The floor is all yours, sir.
Thank you, and the honour as well as the floor is mine. So good evening, Bangladesh and all points east. Good morning, Americas, and for all points in between, hello, and welcome to this session on healthcare as a social business in the context of the pandemic and post-pandemic era. So although I'm your moderator, I just wanted to set the context really. And of course, at the heart of the 3 zeros are health and healthcare. Healthcare, poverty and employment are obviously intimately related. And the COVID pandemic has revealed and reinforced that observation, along with many of the social and structural vulnerabilities and inequalities that were already in place, and which social business is set up in many respects to address. And our healthcare systems are no exception. And the inadequacies are expressed, I think, largely in the context of this session in inequalities in health outcomes and in access to quality care. So that's really the context for our excellent set of panelists who we've asked to engage in conversations then about how social business can assist healthcare systems both during and after the pandemic, not only in overcoming these inadequacies, but also in creating high-skilled professional jobs where they are, in fact, most needed. Before we move to our panel, however, I did want to say a few words to Professor Yunus, as well as wishing you a happy birthday, Professor Yunus. I just also wanted to invite you to say a few words by way of introduction, if indeed you want to take up that option.
Probably you sell it to Sajid. Sajid.
Not sure Professor Yunus is going to take up that option. Sorry, I seem to have sprung a surprise on
Hello.
on Professor Yunus. So, hello, Professor Yunus.
Hi,
It's just
hello.
sorry to spring that on you.
Yeah, no problem, no problem. Good to be with you. It's wonderful to have you with us. It's a great occasion. And on the healthcare side, we believe so many things to talk about. So this is what we're looking for, and your leadership is so important. Please go ahead.
Great, thank you so much. So our first speaker is Vanessa Kerry. Vanessa is well known to lots of people here as an Associate Director of Partnerships and Global Initiatives at Massachusetts General Global Health, and is an Assistant Professor at Harvard Medical School, but is probably best known to the group here as co-founder and CEO of Seed Global Health, which has multiple accolades, but I don't want to go into those because I think that that's really going to be the main focus of Vanessa's presentation. So over to you, Vanessa, for the next few minutes. Welcome.
Hi, Vanessa. Welcome. Fantastic.
Hi, Professor.
Good to see you.
Thank you. I'm honored to join you, and happy birthday.
Thank you.
Mary, forgive me for calling you out, but that's a happy birthday. It's an especial pleasure to be with all of you. Yeah, the reality is we are gathering at a profoundly existential time today. We face deep challenges, climate change that's altering our communities and challenging our resources. We are witness to, and if we're honest, often participants in growing inequity gaps. And we are facing a global pandemic that is ravaging the world today and really reflects our deep underestimation of the importance of health, equity, and which is also profoundly spotlighting the social determinants of and access to health. So I would argue there is an essential opportunity to rise to this occasion and redefine our values for sustainability and well-being. This has been the focus, as you all know, and of the work of Professor Yunus and of many of the other speakers today who I'm honored to listen to join, and to learn from. But together, we really need to ask, how do we want to live? What do we measure, and what defines our success? And how are we going to create that? Because it is not an economic bottom line. Today, we have to realize that our sustainability relies on our moving in a new direction, because the world we have been living in today is no longer a healthy one, and certainly not one in which we all thrive. This idea is not new. It's actually been the work, or considerable amount of work, has been done to shape this agenda by the economist Joseph Stiglitz, Amartya Sen, and others, all fellow Nobel laureates. And they've argued for a long time that we should not be measuring ourselves against GDP, but on measures of success that are defined by education, health, our measurements of success towards the environment, and the quality of life of our citizens. And we've been making a slow march towards this shift, but in 2021, we cannot afford to go slowly anymore. And for my work and that of Seed Global Health, we have aimed actually to support this exact agenda through investments in the health and the health workforce. Because it turns out, as you all know, health is fundamental, not just to our individual ability to survive and to thrive, but to our collective well-being and the stability of our communities. There's growing number of macroeconomic studies that have shown the importance of health for our national growth. Investments in health have been shown to increase GDP by up to 4%. And nearly 1/4 of growth in middle and low income countries from 2001 to 2011 actually grew out of improvements in health. But this isn't, again, about the GDP. Because on a smaller level, on a local level, a UNDP study in Zambia showed that when the main breadwinner of a household dies of HIV, 2/3 of those households experience an 80% decrease in income, 61% have to move to cheaper housing, and 21% of girls in those households have to drop out of school. And on a more personal level, better health, we know, leads to more income, less lost work days. In fact, ill health and health shocks have been shown to increase the probability that somebody has to leave the labor market by up to 50%. And even after recovery from whatever that poor health shock was, up to 2 years later, people have not recovered their income or their jobs. And if there's any doubt, though, about this connection, COVID has shown the incontrovertible proof. Because with COVID, we have discovered exactly how critical health is to our daily lives and how poor health worsens the pre-existing inequities that we've actually seen in the world today. We've seen it throughout global vaccine distributions currently, but here in the US, where I'm based, we've seen it in the disproportionate numbers of cases and deaths among Black Americans, Latinx, Native Americans, and that discrepancy has just been getting worse over time. What's very fascinating to me, though, is that as we respond to COVID, we are still in danger right now of making the same mistakes and perpetuating the power dynamics of old that have elevated a few and kept so many locked in poverty and poor health. And so as we look to this moment and how to best respond, we have got to see this opportunity to do things differently. And for me, through the work we do at Seed, I want to present to you the fact that we have an opportunity to invest in people at every level. Because healthcare is a human-centered intervention. People are at the heart of a health system, both as patients who need care, as well as those caregivers that are offering the attention and the quality of care needed. Today, though, there's a global shortage of 18 million doctors, nurses, and midwives in 83 countries around the world. And these shortages are worst where the burdens of disease are highest. And for some countries who've been hardest hit by HIV or malaria or TB or maternal mortality, that means there's only one doctor or a handful of nurses for every 100,000 patients. These shortages, though, translate into very real health outcomes. 99% of maternal mortality occurs in lower middle income countries. 80% of non-communicable disease deaths are happening in low middle income countries. And what the result really is that there's unnecessary vulnerability also in the face of COVID and in the people who are dying today from this pandemic and in the inequitable rates of death and suffering. Indeed, the need for healthcare workers is actually a significant barrier to our vaccine scale up, because for every $1 of vaccine that has been donated, there's $5 needed for the delivery of that vaccine to the populations in need. And half that money is actually needed for the training of the healthcare workers and investing in the healthcare workers to deliver that vaccine. But if we do this moment right, as we respond to COVID, we actually can be responding to all of the other slower burning pandemics of non-communicable disease, maternal mortality, or malaria, which are killing millions combined annually. But it starts with training the needed workforce who can address all of these challenges, who can respond to the patient who is sick with COVID, or the patient with heart failure, or the mother in distress, or the child who needs antibiotics. Because the healthcare workers serve as the backbone of stronger, more resilient health systems and communities. And at Seed, we have seen this. We have partnered over the last 8 years with governments to train over 23,000 doctors, nurses, and midwives, and to help fill those gaps and train a rising generation of health providers who can not only provide care, but can train their successors and be agents of change themselves. Built over multiple years, programs like those that we've created with the government of Uganda and Lira University in the north of the country have now helped graduate over 90 midwives who serve the country. Of the 32 graduates in 2019 alone, all 100% today are employed, and 87.4% of them work in the public sector, maternal and newborn facilities. And most have actually stayed in the rural north where they trained. Investments in the health workforce are essential not only for health system strengthening, but for resilience and responsiveness of countries. They spur economic growth and development, and they create resilient jobs. Data has repeatedly shown that the return on investment in the health workforce is significant, averaging on average, averaging a return on investment of up to 9-to-1. And actually, according to the Uganda Bureau of Statistics in 2019, the 30-year return on investment of the health workforce is a whopping 51-to-1. So it turns out, though, that investing in the workforce is also essential to gender equity. Almost 4 million women make up close to 50% of the global workforce, contributing $3 trillion to global healthcare globally. And nearly half of this care, though, today is unpaid. But beyond the equity and agency to women benefits, the WHO has found that equal participation by women in the global economy would result in nearly 160 trillion increase in global GDP, or 21.7% increase in human capital wealth, which is more than enough to afford the healthcare investments that I'm arguing for today. The power of the health worker, though, just to close, is experienced through a very simple story. And to give you that example, I want to share the story of one of our faculty who served an obstetrician in one of our partner countries for an academic year. On her second day at her site, she was called to the operating room urgently. There's a mother who was there in obstructed labor. She'd been laboring in her village for 3 days. They had lost the baby. But our faculty realized, our educator realized that she didn't want to lose the mother and she didn't need to. And she performed the life-saving procedure that saved that mother's life. But she actually also saved the lives of 5 children that mother had at home. Because data has also told us that you are more likely to grow up socio and economically disadvantaged if you lose a mother throughout your childhood. So those 5 children now had a different promise and opportunity for their life. But she also saved the lives of mothers in the region where she was working, because in that country, 1 woman dies every hour from a complication of pregnancy or childbirth. And by showing when and how to do that same life-saving procedure and working side by side with her colleagues throughout the year, training others, bilateral exchange, learning together, training her successors, she helped build a cadre of skilled workforce that was invested in the community and knew how to respond to those mothers who were in need. And so she helped create a ripple effect. That ripple effect is what we are fighting for every day at SEED and have seen work over the last 8 years. But imagine that potential scaled. It is lives saved, jobs created, countries lifted. I am forever an optimist, even in the hardest of times. And this optimism, though, continues to fuel my belief that today, even in this dark hour, there is an opportunity here, if we choose it. We have an opportunity to live a different set of values that we define together. We can create jobs that serve the needs of our populations, that promote gender equity, that invest in health, education, and well-being. We can do well while doing good. Thank you very much for letting me join you today.
Thank you.
Brilliant. Thanks, Vanessa. What a fantastic start to the session. I would urge members of the audience to use the chat and the Q&A function to put in any observations and particularly questions that you might have for Vanessa and for our other speakers as we go along, because we hope to return to everyone as a group panel towards the end of the session. But for now, we'll move to our second speaker. So we're going to have more brilliant examples of organisations like the one that Vanessa just outlined forthcoming. But we're also going to have a couple of approaches to this issue outlined. And the first one is really around issues of change management, and that's going to be led by Dipesh Nag, who's Managing Director of Grameen Danone Foods Limited. Dipesh has been educated at Asian University of Bangladesh, the University of Dhaka, and has worked internationally previously for organisations like Novartis and Orascom Telecom. So over to you, Dipesh, and we're looking forward to hearing your thoughts.
Welcome, thank you, and welcome everybody to this session. Really great to see all of you together. Very much privileged to be part of this discussion. If I may I share my screen? Is it okay?
Yes, sir. You can.
All right. So, okay. Can you see my screen?
Yeah, that's good.
Great.
Recording in progress.
So today I'm here to share you the story about Grameen Danone, and we will talk about the evolutionary journey that we are having amid this pandemic to bring health through nutrition. And so before I start, let's start where it all began. So it all began 16 years back when two visionary game changers meet together and devise the first social business enterprise of its kind. So these two visionaries are Professor Dr. Mahmoud Yunus and the group CEO of Danone, Frank Ribu. And they have started the concept of a social business and devised a product. Okay. So the objective of the business was to address the malnutrition of the kids that Bangladeshi kids are facing in terms of nutrition, the four top deficiency that the kids are facing in the country: zinc, iron, iodine, and vitamin A. So our product was designed specifically based on that, with the core competency of Danone, which is yogurt, and then fortifying the yogurt with those micronutrients, and then providing it to the rural areas through a specific sales network, mainly focusing on micro distribution, micro entrepreneurship, and focusing more on women empowerment. So it's a social business end to end, starting from material sourcing to the very last mile distribution. It's focused on engaging people of local community as much as possible so that it creates employment to the maximum level. So even the milk farmers that we are sourcing milk from, 60% of the milk farmers are actually women. So, okay. Then back in 2020, in March, suddenly we get struck by COVID. And at the same time, I started my journey with Grameen Danone as well. So COVID entered the world and I started working from Grameen Danone. Both happened together. And when it happened, actually, at the beginning, we had absolutely no idea what to do. Then at first, we stopped our operation because it was risky to do that. And then when we stopped our operation, a lot of people who are in our ecosystem, almost 3,000 families are linked with us in the ecosystem. So part of that families, they had no other way to earn their livelihood. So then we decided that what we should do. Rather than focusing on any formal procedure, because all other procedure will take time. So we decided as an organization, individually as employees of Grameen Danone, we started contributing and created a fund. And from that fund, we find out who are most vulnerable in our ecosystem, whether they are farmers, whether they are in our sales force, or even our colleagues. So then we find that group, and immediately we provided 2 months food around 100 families, and we created the project called We Care. We are continuing that initiative so that we can immediately cater people who are in our ecosystem, because if we survive with the whole ecosystem, in that case, actually we can go further later on. So that was the first action we did. Apart from that, you can see here, we started collaborating with Red Cross, which is named Red Crescent in Bangladesh. So for 1 month, we have contributed to food supply of 500 families, which are like in really bad situation. And even right now, as the second wave, as a big wave of COVID is really going to affect us, we have started discussion with this type of organization, so we can contribute to the society. And the thing is, for us, we are very close to community, so it's easier for us to immediately get involved in that sort of initiative. We are leveraging our exposure of being close to the community, and we are contributing in this way. So then, it was all about ecosystem, and in our ecosystem, it really starts with the employees. So the field force that we have, the van pullers who are not directly our employees, and also the sales officer who are our employees, as we have to restart our operation, because we have to also continue to supply our product to the market, the kids who needs our product. So to ensure that we started operation immediately in May, one of the first organizations started distribution in the last mile, and then we took care of our employees before we started operation. So you can see here, everybody is having mask, and then also having the soapy water. At first we started with the hand wash, and we continuously communicated with all our field force that they have to wash their hands, social distance. You can see the meetings that happening in the field in the morning. They're keeping the social distance. It's a regular scene in our organization. And then all of them are provided with branded masks, not only for them, but also for the distributor, for the families of the employees. So all are covered. That's not only the people who are working for us, but also the people who are around them. We are taking care of health and hygiene as much as possible from our end. And then in terms of, you can see here, in terms of the farmers that are with us, because they are heavily struck by COVID, many of them are selling their cattle. So what we did, we have started a feeding program, a feeding support program, whereas we are giving a feed for discounted price, which is half, other half is borne by Grameen Danone, so that they can survive in this tough context. At the same time, the long-term relationship is also built. And then Sajid Bhai is here in this discussion panel. So a great initiative from his organization, that COVID insurance. So we have taken full advantage of that. Actually, we have insured all our employees on this COVID insurance of digital healthcare solution. And apart from that, all the farmers and their families, we have supported them get insured through this, because it was an online procedure, and not all of them are very much expert in that. So as organization, we supported them in getting enlisted and get this insurance coverage. And a lot of people who were affected by COVID after us leveraged from this insurance. So it was all about taking care of its ecosystem and employees, and then come to the business. Because we have a very unique product, and the product is providing micronutrition to kids, and like in this tough context where the health and nutrition is even more important than before. So people knowing what is the connection between nutrition and health is very much important. So in that context, we really started all our marketing campaigns and digital campaigns focusing on health benefit, rather than focusing our product as a, let's say, indulgence product. We more focused on making the connection that how nutrition is there. So in Facebook, we have live sessions with the nutritionist, more than one. Actually, we have 2 or 3 live sessions with nutritionists, giving nutrition ideas to the parents, and at the same time connecting how our product can cater the need of nutrition of kids. And apart from that, also the point of sales material or the posters that we put in the shops, we featured doctors who so that people just from a look understand that this product is something which is beneficial for the health for their kids. So we started focusing on that. Then we started establishing animations, cartoons, and focusing on the social distancing, the importance of using masks, because all the level of awareness in every family in Bangladesh is not same. So we wanted to give the message through our marketing campaigns that why using mask is important and why social distancing is important. Then we have regularly quiz connecting our product and connecting the nutrition, and how this nutrition is helping one person to survive or sustain in this tough context of COVID. So this is where we are focusing. We are focusing the health and nutrition benefit of our product and connecting it all together, so that very easily people can get the idea how Grameen Danone is contributing in terms of nutrition, and how this tasty yogurt is also ensuring the let's say well-being of the kids and how we are contributing to that. So far, this is all what we have been doing so far. And then, so in the current context, the major challenge we are facing, that the schools are closed, and 60% of our volume or our sales is coming from schools. So so there is no way we can reach to kids, and sales volume is dropping very fast. So the impact is getting less and less. So what we did, as the kids are not coming to the schools, to the streets, we started going direct consumers. Taking all the health and safety precautions, we started going door to door so that people have the awareness and the connection is not missed, because like if the marketing, there is no activities to connect consumer with our product, then the people will start forgetting about it. So we started going direct to consumers. Even people not coming to the streets can buy our product from their home. We have started online delivery. And as the schools are closed, so we redesigned our routes. So rather than going into shops which are very close to schools, we started or redesigned our routes so that we are in the areas where the proximity to people, where a lot of people are around in the localities rather than schools. And we populated the stores where the footfall is much more higher in this COVID time rather than in other areas. So,
need to wrap up, Dipesh, need to wrap up.
Okay, all right. So last slide. So, in the current context, not only the kids need our product. So nutrition is also required for adults as well. So to expand that horizon, during this COVID period, actually, we have launched our new product range, biscuits and wafer. And you can see that even this biscuit people can take with tea. So adults like me, we are taking this product regularly, and our plan is to fortify these products as well so that nutrition can be reached even adults through our product. That's all from my end. Very happy to answer any questions if it comes. Thank you, and
Brilliant.
back to you.
Okay, so I mean, once again, I would invite people to put any questions or thoughts into the chat or the Q&A, but it's always really good to hear what the latest developments are with respect to Grameen Danone. So thanks very much for that, Dipesh. So our next speaker is Monica Younis. Monica is an award-winning operatic soprano and graduate of the Juilliard School, and has also received multiple prestigious awards for her humanitarian work, including being co-founding director of Sing for Hope, whose mission is to make arts radically accessible, and in doing that, to unearth and support talent wherever it is found. And I believe that we're going to hear about one of Sing for Hope's particular initiatives in light of the theme for today. So over to you, Monica, and of course you are most welcome. It's good to see you.
Good to see you and delighted to be here. Thank you so much, and good day to everyone today. And happy birthday to my dad. I'm very happy to be here on this particular day to celebrate. As Cam mentioned, Sing for Hope transforms lives through the power of the arts. We bring artists to places like schools, hospitals, elder care facilities, and public spaces. Through performance and artistic engagement, we enliven community spaces. We're probably best known in the United States for the country's largest public art project, the Sing for Hope Pianos, which places artist-designed pianos in parks and public spaces for anyone and everyone to play, and then are donated to schools, to public schools. Today, I wanted to talk a little bit about our Healing Arts Initiative at the Javits Center. The Javits Center is, of course, one of the largest vaccination centers. Sing for Hope at the Javits Center is providing a powerful solution for the dual crisis of artist unemployment and patient caregiver anxiety. Beginning March 1st of this year, Sing for Hope has provided daily musical programming at the Javits Center during vaccinations. We're producing a 7-day-a-week musical series featuring 3 to 5 musicians per service, employing our finest caliber of artists from Broadway, Lincoln Center, Orchestra of St. Luke's, the Metropolitan Opera, and many more who have been unemployed since the stages have been closed due to COVID-19. In the United States, according to Americans for the Arts, 95% of artists have been unemployed or underemployed still to this day. And even as stages are slowly beginning to open back up, the statistics are pretty dire for that industry. The effect of this program on the Javits Center has been really transformational, according to the doctors, nurses, and the National Guard on duty. We've been so moved by their gratitude for the program, which makes their job so much easier. As I mentioned before, just to give you some scale, the Javits Center in New York City is one of the largest vaccination sites in the United States. This 7 days a week program at Javits Vaccination Site has had tremendous immediate impact for artists and communities. 450 plus professional paid artist services to date for an estimated 270,000 patients, medical staff, and National Guard impacted, as well as a long-term industry-changing potential. Our program is implemented in partnership with the Javits Center, and Sing for Hope is currently awaiting the confirmation of a proposed study from the New York Department of Health to assess the impact of live music during vaccine administration, which would have significant applications for the fields of art, in healthcare. Our programming before the pandemic was live and in person, and I was thinking to myself as Depeche was doing his presentation, we had the same thought, which is to say that if you can't go into schools and you can't go into hospital settings, and all of our programming was based that way, what could we do? So one of the other initiatives that we've taken on, since so much of Sing for Hope's programming was live and in person, was to pivot, as so many organizations have done, into the digital realm. So Sing for Hope has created a platform that we call Open Arts, which is it has over 100 live interactive performances each month, presented by the brightest stars from world's leading stages, which is completely free. So if you go to singforhope.org/open arts, anyone can sign up for these free performances, movement classes, story time for kids, presented by the most incredible artists, all from your computer screen. And all of these performances are happening live. So the communities where we used to go in person, we're now reaching out to them to let them know that we have this wonderful resource. I do want to mention that those performances currently are happening for US-based audience, but we do hope to expand that so that many more friends globally can come and enjoy these live performances. We've created a virtual lobby where audience members can ask the artists questions after their performance, so it really is interactive. And it's a wonderful way to stay connected through the arts, both for the performers as well as for the audiences with whom we're connecting. I just wanted to take a moment to show a little bit of the actual programming from the Javits Center. And so if our friends at the Unicenter would kindly queue up the short video we have, that would be wonderful. And I'm open to any and all questions. Thank you so much.
Musicians around the country are trying to ease the nerves of those getting their COVID shots by performing songs like New York, New York. For many musicians, this is the first live performance for them in a year. The pandemic has devastated the arts world, and live concerts and theater have been almost non-existent. I spoke with one group of New York City artists who are trying to soothe the soul with a little melody. For most of us, life's milestones are marked by a soundtrack. That's why performances are popping up at vaccination sites across the country. And whether it's Yo-Yo Ma in Massachusetts or Richmond Philharmonic players in Virginia, it seems clear there's medicine in music.
Was actually really great to come out of a really tense, environment and hear the music. When I sat down, they were playing God Only Knows Where I'd Be Without You, the Beach Boys. So it was a nice feeling.
In New York City, the Jacob Javits Convention Center's sprawling campus has transformed into the country's largest vaccination site, vaccinating 14,000 people daily. Javits CEO Alan Steele.
I mean, this represents freedom. They don't lose their mask, but what they do is they lose some of their inhibitions about the future.
And while there's understandable anxiety,
in the beginning, I was nervous, a little bit.
The music offers a relaxing remedy for patients.
We've noticed that there's a direct correlation between decreased levels of anxiety and calming people's nerves when the music is present.
And a place for artists to finally perform.
I have artists every day looking at me and saying, you have brought me back my first gig for the last year.
Opera singer Camille Zamora is co-founder of Sing for Hope, a nonprofit that's hiring musicians to play the Vaccine Center. For many, the first crowd they've seen in over a year.
Well, I was playing at Phantom on Tuesday and I think Moulin Rouge on Friday, and then everything shut down.
Violinist Victoria Patterson teamed up with Zamora after the pandemic shut down her busy Broadway schedule.
I live in this neighborhood and I was out on the ground basically looking for places to play. National Guard is here. It's not like a warm and cozy place, so we can just soften the mood and feel like celebration, I've worked so hard to play on Broadway and to get where I am. And now with the pandemic, I'm like, I can come back from this, wow.
It feels like water in the desert. It just feels like what we've been missing. It's the cheapest, oldest medication that we have. It's music.
Sing for Hope was created after 9/11. Camille Zamora and her co-founder were students at Juilliard at the time, and just like now, with the pandemic, everything came to a halt, and they wanted to do something to bring joy. So they gathered some musicians and performed for first responders. The rest is history. People who don't like to be vaccinated, the doctors tell us that when they hear the music, they calm down.
I get it.
Their pulse, is a little bit calmer, and they're able to do it.
This is great for everybody, because you were saying the musicians do get paid for showing up for this.
That's right. This is a paid gig.
Yeah.
Many of them have not had that.
Have not had it in quite a while.
Right.
Yeah. So that's
But
great
it's so
too.
soothing, though.
Yeah.
It's so soothing when I went, because I'm very, very, very afraid of needles.
Yep.
And all I could do was ask the person, could I hold your hand? They go, it's hard to give you a vaccine. Well, can I just hold onto your waist?
Well, we should tell people,
so nervous.
this shot, you barely even notice it. It's like a little tiny thing.
I have to say that was true. Psychologically, I was all worked up. But you're actually right.
It's
when
not
it
a big
comes
needle
time to
coming
do it,
at you. You don't even, when it happened, I was like, was that it?
I still would have liked some music, though.
Well, and also
That
you're in a
would've been
big
nice.
space. A lot of people haven't been indoors with a crowd
That's
of people.
really true,
So it's not just the needle, it's actually coming to a big space where you haven't been able
So
to do
that's just down the road at the Javits Center, right?
Javits Center,
I don't want to walk in on my way home, but...
Showing the video, I appreciate that and welcome any questions. Thank you all.
Wonderful. Thanks, Monica. Again, just more inspirational material for us all with respect to what you're doing in the US through Sing for Hope. So we'll move on to our next speaker, who is Sajid Rahman. Sajid is a well-known digital innovator serving as Chief Executive Officer of Digital Healthcare Solutions. He's also an angel investor, a technology leader. He's worked with huge international organizations in leadership positions like Standard Chartered Bank, for example, and sits on boards of several other organizations, and is a regular speaker and blogger on technology trends. So for that theme of digitalization, welcome, Sajid, and we're looking forward to hearing your thoughts.
Thanks, Cam. So, I think one clear theme that was coming from from Dr. Kerry, as well as the other discussion, is that the healthcare is broken, right? I mean, whether we are talking about any markets in emerging countries, markets in developed countries, healthcare in general is broken. And so the question for us who have been in the healthcare system is, how do we actually change the basics of the delivery? How do we actually improve the scalability of a quality healthcare? One of the themes that Professor Yunus, we launched this 3.0 Cloud. One of the broader theme that is coming across is no going back. So the old way of delivery, old way of interacting between doctors and patients, old way of delivering medicines or collecting samples are not going to scale. And in a time of crisis, in a time of pandemic, clearly the healthcare system were not equipped to support that burden. So one of the things we started doing in digital healthcare solution is to look at the problem from a bottom up, from a first principle context, and wanted to see how we actually can break apart the way it has been delivered and then put it back on top of a technology platform. Now, one of the things that we have seen happening across markets is that the proliferation of mobile technology. Whether you're going at a remote part of the country, very remote areas where hardly, even a proper clean water is not available. Even in those places, there are, robust mobile technology, mobile signaling. So we thought, okay, if we want to build something ground up, it should be on a platform that is available across the country and across the society. And mobile network seems to be that platform. So we used that platform and started building on top of it our different healthcare solutions. The first solution that we built was essentially trying to inform people the right way in local language, because whenever you search for information on any healthcare topic, whether it's hypertension, whether it's COVID, whether it's cardiovascular disease, the information that gets out in a Google search or any other options are many misleading, right? So are broadly misleading. So the question is that, can we put out contents out there which are clinically proven, which are written in a way that is easily understandable? So that's how we started, and we tried to make this content much more engaging and interesting, almost not like a very dry clinical, words and content, but a very, very friendly way, as if a doctor or a friend talking with another friend. So that's how we started the content. And then the second problem we try to resolve is a very basic problem across most of the markets, is doctors to patient ratios, right? So in most of these countries, there are very few doctors compared to patients, far below the WHO guideline. And most of these doctors are based in cities. And so if we go to villages, remote parts, the ratio gets wider. So what we did is we created this whole consultation system. First, we started on a very simple audio call, like any phone call, whether it's a smartphone, whether it's a very basic, mobile phone. From there, we started the whole videos. From there, we started the whole SMS. From there, we started even the Facebook Messenger, because in countries like Bangladesh, Facebook Messenger is sort of known as internet rather than the actual internet. So we started building this whole consultation system, initially with primary care, and then we started bringing in specialty like diabetic specialists, patient specialists, gynae, different sort of specialist doctors coming in. And then, of course, as we started building this whole health consultation system, then the other side of the, if we consider this as a supply demand thing, then the other side of it is to bring the doctors to the platform. And that's where we started creating the scheduling system for the doctor, billing system for the doctor, so that we can get the top doctors and others on the platform, so that it works both ways, the demand meets supply. And then the third thing, which is probably not very familiar for those who are listening from developed markets, is the lack of health financing. So, countries like Bangladesh, there's hardly any health insurance. Most of the expenses are out of pocket, almost like 70-80% out of pocket. The few people who have health insurance are probably working in top companies. So in that scenario, every year, I mean, we don't have the exact data for Bangladesh, but we have some data for other markets. But every year, millions of people go below poverty line just to meet healthcare expenses. We have a case where, a person, because of the kidney treatment, started in village, sold his land, sold his houses to meet the treatment, couldn't make it, moved to the city, started living in a slum area, and ultimately could not meet the expenses and passed away. And there are many cases like that where not only the patient but the whole family goes below poverty line. So the question is that, can we build a safety net to ensure at least some of these costs are met? So we started the health financing, a very affordable health insurance program, and we have hundreds of examples how this helped to get. So in fact, we turned out to be the largest health insurance book in Bangladesh, given the way we expanded. One of the questions we used to face from the top insurance companies in the world is that, because they according to them, they wanted to create a broader network, but apparently couldn't because of the per unit cost and everything. And that's where technology stepped in. We did the whole thing on a technology platform, on a mobile system where the monthly premium or the monthly payment is taken from the airtime, like a phone bill. The payment is done through a mobile wallet. The whole claim process is automated. Someone even submits a claim through a Facebook Messenger, where is a bot, a chat bot helps them to submit a claim. So the whole thing automated. So it took away the huge processing cost, the intermediary cost that actually adds up ultimately in a consumer, when the consumer pays the price. So essentially, we disintermediate the whole process in between, streamlined it and reduced the cost. And as we scaled, obviously the per unit cost came down. And of course, all this, because we built all this infrastructure, it helped us during the COVID time. We heard about the COVID insurance. We were the first in the country to go out, starting with automated symptom checker in local language. And then, of course, we started COVID insurance, we started COVID consultation, we started working on collecting samples for PCR testing. So we really scaled that because we already had some of the solutions available or some of the infrastructure built in. And that makes me hopeful. That makes me hopeful because I think, as we struggle to solve this massive, hairy problem of healthcare challenges across countries where most of the countries are resource starved, lack of understanding of the problem, lack of awareness of all the challenges in everyone. I think this is one of the ways we can really make a dent into this problem, build a solution based on technology available to most of these markets and make it easily accessible, where we can scale without compromising the quality. And that's what we're trying to build in digital healthcare solutions.
Brilliant. Thanks, Sajid. As I say, brilliant as ever. So we will definitely be coming back to you in the Q&A session. But our final speaker is Maureen Chowdhury. Maureen is a director at Grameen, Caledonian. He has an MBA from the Cass Business School in London and has worked in London as a principal consultant for Frost and Sullivan before being appointed as director of finance at Maxwell Stamp PLC, where he worked on several UK Department for International Development, or DFID, projects. So over to you, Bowen, for some final panelist thoughts.
Thank you so much, Cam. I am actually leading this company as the managing director. So let me start with how we came into being. When Professor Yunus was lending money in the mid-90s to the Grameen Bank borrowers, it was seen that at a certain stage that they're again falling back into the poverty line. So he started a program in 1996 named Rural Healthcare Program, RHP, which gradually transformed as full-fledged social business company in 2006 named Grameen Kollan. I would like to take some help from the slides so that we grow some interest to the audience. Can I be getting this help, please? Yeah, thank you. Okay. Start with just to, okay. So Grameen Kollan is a social business model in healthcare. We are expanded in 30 districts in Bangladesh, having almost 138 health centers. We have almost 1,060 staffs working across the old health centers. We have a small health center in every most of the districts where there is a doctor. There's also healthcare specialists who bring the patients into our health centers. We also have pharmacy. We have laboratory where we can do tests, like even up to the lipid profiling. And these are all based in the hard-to-reach areas. The basic services that we provide is doctor's consultation, basic diagnosis inside the health center, access to medicines, and door-to-door services. We always provide services to the poor community, those who are living in the marginalized life. And one of the most important selling points in our company is offering micro-health insurance, which was a brainchild of Professor Yunus. There, you can spend only $3.5 and treat and give the facility to 6 people in the family to be treated in our health centers. And if they come there, when they come into their health centers, they get an offer of 30% discount in their services, which is a big help for the poor families that we have in our country. Let me just explain that what we did during the COVID period, as the topic is as such. Now, we being one of the largest healthcare providers in the country, we have done some jobs for the people of our country, especially for the poor community. Before that, what we did is we secured our employees first. And we followed the guidelines of World Health Organization for all the safety guidelines. And you can see in the pictures how we have ensured safety for our employees first, and then provided the services to the people who need it. We have our own industry where we have prepared PPE, personal protective equipment, and we have given to different hospitals, and we also have exported to US. And there are many gloves, numerous numbers of gloves we have given, goggles we have given, and there are many other sanitizing materials that were always available for the poor people as well as for our employees. We have also distributed almost more than 500,000 pieces of free non-medical masks among the people in our functional areas because they couldn't afford, so we have used our fund and gave it to the poor people. There were almost 200,000 leaflets that Grameen Colombian has distributed among the poor people so that they're just to create an awareness as to what should they do to fight this COVID, which we are still fighting. We also have given food support. We call it food support program with our own fund to almost 5,500 impoverished people. I mean, the families that we have conducted. You can see those pictures that how we have done this. And at the same time, during the flood was there, so we have also provided some free medical camps for the affected people. This is an interesting thing, and I really want to discuss that where we are struggling. See, in Bangladesh, we have 3 doctors and 1 nurse for 10,000 people. How difficult it is to provide service under this such COVID crisis. This is as per WHO statistics. We have only 4 beds for 10,000 people. What a difficult time that we are facing. And this country is going to be a total shutdown from 1st of July. I don't know what's going to happen at that point of time because our COVID has increased almost 50% from the previous time. The deaths have increased 50% from the previous time. So every day there are hundreds of people that are dying. We have a budget of 5.4% of the total budget where the people in our country are struggling with their money to be spent in the healthcare. We don't have universal health coverage. So that is where, because the SDG says by 2030, the world will come into the umbrella of universal health coverage, but we don't see anything as such in our country. There are leading countries, they're also having, but they're not also having full-fledged universal health coverage. Let's come back to this slide where I really wanted to show that what we have learned so far from the countries, those who have successfully managed COVID-19 as on today. Well, there are different variants coming. Now the variant is a bit different. So what should they do, or what should we do here? What should we learn? Like early and effective actions to control borders that we must do at this stage. We should do testing, tracking, and tracing everyone suspected of being infected. We must provide welfare support to those in quarantine who are contained in virus. There has to be an effective leadership and consistent, and then the government must use public messaging to aware people. And one of the most important strategies is vaccination strategy. There are 1.8 billion vaccines produced, and the developing countries probably have got only 0.8%, which is so meager. And I doubt that where will be our vaccine strategy? We don't have vaccines. We're struggling. Next is, what is our recommendations for the imperative healthcare measures? What we can do specifically for our country? Like, there should be more global and national level researchers that we can do research on communicable disease control, as well as guidelines, policies. This has to be disseminated in systematic way. Our country, I feel that we should have an explicit 10 years of planning of countries' healthcare systems, where private and public, everything should be together to understand that how best we can provide services to the people of our country. There is a campaign going on by our chairman, Professor Yunus, on global common good, and I also vow with him, like, world leaders should ensure COVID vaccination coverage for people of the planet, to ensure that we are safe, and also to make sure that the poor who cannot afford, who are below the count, should get access to these vaccines. There has to be strong resilience to build this and support the significant amount of the new poor which has been created. As on today, Bangladesh has almost 25 million people. They have already thrown into the poverty basket. So we need to lift them, because when we rise by lifting people. Healthcare and pharmaceutical companies should not prioritize their profit as their only maximization object, but they have to come out with many more services and make it absolutely reachable to the people of our country, especially to the poor people. And I'm sure Bangladesh government will think about providing universal health coverage if they want to align with within the umbrella of providing universal health coverage by 2030. There are few steps that Grameen Group as a whole is taking to ensure that we provide more services, healthcare services, to the people of our country and beyond. First and foremost is the 500-bedded hospital, which is called Samajik Hospital. Samajik means social business hospital. This is a 500-bed hospital with 93,000 square meter of space. The hospital will have 500 overnight bed capacities with 105 ICUs, 16 operation theaters, including 2 hybrid ODs, and 82 consultation. You can see all this, like 68 physicians. We are trying to reach out to the people from all walks of life, not only one segment. There is the beauty of this social business, because we want to become big, keeping the money within the company, not profit maximization. The next, we are coming up in the same block, is the Samajik Medical College, where we will have 500 students, 100 in each academic year, with 20,000 square meter academic and lab facilities. There will be 11 departments in this hospital. This is going to be operational immediately after we commission this medical college will be operational after we immediately commission our hospital 3 years later. The next is Grameen Caledonian College of Nursing. This is already in operation. This has been completed, a state-of-the-art building in Bangladesh, in Dhaka. And all this complex actually were based in Dhaka. This is 35,300 square meter and comprises academic facility for 900 students, with a residential facility of 700 female students. And this is one of the nursing colleges worth seeing. A lot of people are coming to see, because this is where we are going to have our huge health complex. We will also have Samajik Health Technology Institute, because as on today, I can say that there are shortages of doctors, which is 100,000 doctors has a shortage in our country. We have 800,000 shortages of nurses and paramedics and lab technologists. We need to build them. So this is the offering that we are having in our offer for the country as well as beyond, because I'm sure there are many students who will come from abroad as well. We are not only concentrating within Dhaka city, but there is second capital, which is called Chowdhury. We are also thinking to build a teaching hospital, the similar teaching hospital that we had in Dhaka, we will have in Dhaka. This will be in Chittagong, which is a 250 bedded hospital, but this will support to the world-class nursing institute that we will build in Chittagong, which is almost 500 seated hospital, nursing college. And today, Professor Yunus has announced that Grameen will also be participating in having a social business pharmaceutical company, which will be a great support to the country as well as to the world for providing vaccines. So we will be waiting for the technology providers to come and help us on that. Thank you very much, Cam.
Thank you very much,
I'll
Maureen.
welcome questions. Yeah.
Wonderful presentation. So we can go on for about another 10 minutes. Aisha's just informed me, so I know that's an even later night for some of you, and maybe a later start for others elsewhere in terms of other things you want to do today. So there are some questions that have been put into the chat function, mainly amongst ourselves, but one for you, Vanessa, was about sort of retention issues. You seem to have really good retention with respect to staff in areas of greatest need, and is that something you pay special attention to?
It's a great question. So retention is the thing that keeps me up at night, right? Because there's a bottleneck to training, but then you need to keep people in the system. And this certainly has been brain drain and all these phenomenons has been a major concern often in these parts of the world. And absorption is critical. Absorption, though, has to do with financing, it has to do with governance, and it has to do with generally creating salary streams and the ability to support these folks over time. So we do worry about retention. We focus very much on the things that we can control. So there's a number of different things that will cause somebody to want to stay in the healthcare sector. One, obviously, is if they're paid, but also things like, can they practice what they trained in? Do they have the tools of their trade? And can they save lives and see the difference of their work can go a long way? We can help control some of those pieces like tools that you have. Can you practice what you're trained in? And really help change kind of the environment and the ability to save lives, which can be very transformative. We are increasingly trying to work with governments in order to help think through the absorption piece and the salary stream and to think through that macro financing. And that's part of why we do focus on the ways that investments in health and jobs can actually lead to resilience of jobs in recession, to economic growth, which can then in turn pay. And if you are saving lives and saving money and building a cadre of people that can participate in the workforce, you end up growing your tax base, right? You end up growing your productivity and you can start to pay for these pieces a little bit better. And so sort of trying to make those linkages for governments in order to create the absorption. But we don't control all of it, but we work very hard to think about the things that we can control. And one of the things that we also know is that people are more likely to stay and work in the places that they trained. And so if you train in rural areas or outside of the major cities, and we work in all different communities around the countries that we partner, you are more likely to be able to, those folks are more likely to stay. And then finally, I would just add that I think as we've had the privilege of working with governments that increasingly see the importance of investing in their healthcare workforce, it gets a little bit easier. So we've just partnered with the country of Sierra Leone to begin a national midwifery training program that the government is very committed to, recognizing that they have the highest maternal mortality rate in the world, and that they need a healthcare workforce that is able to care for those mothers, but that the ability to save those lives will be transformative for the country because health is the second leading constraint to their overall development and growing inequities. And so I think it just comes down to really helping people understand the values we need to be investing in, and that the healthcare sector can be, anywhere from 17 to 20% of your sort of your economy, and that can be a really extraordinary place to really generate jobs, dignity, gender equity, and we are increasingly trying to promote that towards retention.
Brilliant, thanks. Dipesh, you'll have seen a question from me about the kind of longer term sustainability of the Grameen Danone initiative. I just wondered if you were able to offer any insights on that. Obviously, it was a challenge at the beginning, but I think it became less and less so. But then, presumably, COVID has now impacted it.
Right. Actually, there are two parts of your question. Number one is like in terms of sustainability, how it's impacted in COVID. So not only us, I think all the organizations who are operating the similar model as us are impacted by COVID. So there is no question about that. And apart from that, in terms of long-term sustainability, I think before I answer this question, it's really important to understand the end-to-end model of Grameen Danone. So far, all the social business I have come across, like either demand generation, supply, in some point of the chain, there is social impact creation, and in other side of the chain, there are value creation from consumers, like paying premium, or in terms of sourcing, like the sourcing strategy is that the value is generating from there. So only Grameen Danone is the social business, at least that I have come across, that from the origination of material to the end point, the value generation is there. Meaning when we are buying milk, we are buying milk directly from the farmers. So in terms of that, we are not really looking into options to pay them less. So in terms of material buying, we are not trying to, let's say, get the cheapest milk from farmers and giving them less price, rather than we are developing them and their productivity. And then when we are selling, also in terms of the consumers, we are targeting to the kids from the families who are not really rich. So that means from material procurement to the value generation, there is a very thin line where we can play. Then also in the production process, as we are going into simplified production process, we cannot go for automation, whereas there will be, the number of employment will be very less. So there is also another bottleneck. So to overcome all this bottleneck, the only way is to reach a higher number of people where scale of economics will be there. So during my presentation, in the very last slide, I was sharing that we are entering into a new category, whereas the impact will be 10 times higher. That means we will reach 10 times more kids, and at the same time, the value generation will be spread over a longer horizon, so that the sustainability will be coming from reaching into more number of people. So we are on that way, on that path, which is seriously impacted by COVID. But as you have seen, that we are redesigning our business so that we can cover this challenging time and strive forward.
Right.
Okay.
Thank you. Monica and Sajid, I was thinking about the role of universities, and I suppose for Monica it was about, I mean, it was a bit of an odd question to ask yourself maybe, but it's about like is it part of the Juilliard ethos, you know, to be promoting ideas like social business? And then for Sajid, it's more about maybe a kind of a research type question, in the sense of, are you working with others to try and evidence the impact on reducing inequalities that there seems to be so much potential for in your work? We go to Monica.
Monica,
first.
you want to go first?
Sure, absolutely. Yeah, I think that definitely Juilliard has an ethos of excellence, and I think you know, any kind of training in the arts, as in science, it's about sort of a flexible mindset. I would say, meaning that, you know, as musicians, we rehearse, we work, we rework, and I think that is something that serves the matching of arts, and arts specifically in healthcare, really well, because it's kind of like two sides of the same coin. So I always like to say that the arts are kind of the best friend, cousin of science. And so that is a wonderful pairing. And as far as the Juilliard training, yeah, it's definitely about flexibility and seeking out innovative ways of presenting your art, particularly now in a pandemic when so much of the industry has just changed.
Yeah. Wonderful observations. Thanks. Sajid?
In terms of, partnership with academics, so we had some, when we started working on the health insurance component, so with the University of Dhaka, they have a public health and health financing department. So we worked with them on developing some of the health insurance products. In terms of the actual impact, we started work with Johns Hopkins, so we had the outline but could not progress because of different budgets and other reasons. But I can see the logic of having a more independent group do a bit of study and see how it impacts on the longer term. So yeah, we are very open to such partnerships. And we have a lot of anecdotes, but I think it's time to put a research lens into the impact and probably look into it more deeply. Yeah, we're open to that.
Yeah, I think it'd be a really interesting issue to explore at an academia meeting, Sajid. It would be fascinating.
Sure.
Maureen, just coming back to you again, I posed quite a difficult question in the chat, which was about, because, well, you yourself posed many significant challenges, but is there an alternative to current pharmaceutical regulation which currently strongly protects intellectual property and therefore restricts supply of, in the current context, particularly of vaccines? And can we somehow get around that, or is it just about willingness of the powerful to do that?
Well, there are two ways of answering these questions. If you really want to talk about profit maximization, those will not come back to this platform where you want to provide service. But we as Grameen Group, we should talk about social business, because it's not about the question of making money, it's the question of saving life. Now, if you want to save life of people, you've seen 18 billion doses of vaccines that are coming up in the next future. In the near future, probably this has been offered only 100 million to the Southeast Asian countries. So we are so many countries, they're going to take some bit of it like a pie, and ultimately we end up having nothing. So it's all about your willingness, like what you want to do. You want to keep the planet simple, people are dying, or you want to make sure that you save each and everyone's life. I have the right, my poor people have the right to live the way you are living in different parts of the islands. So that's my point, is like, if you want to make this planet a better world to live, then get away from the profit maximization thoughts, come back to the real services of social business, make the companies big, make vaccines available, save people's life, because we don't want to cry the way we are crying in the entire world. Thank you.
Brilliant, thank you. Professor Yunus, any final observations from your perspective? I think you're on mute at the moment. So.
That's right, got it. Now, I was saying we had a very good discussion, very rich discussion on many, many issues. The fundamental issue is health is so important for human beings. It's a life and death issue, suffering and overcoming that issue. But we have not done well on the health sector as a global practice. We missed out all the ways to address it properly. Either we decided to give it to the profit maximizers. So whatever they have done as a ultimate is the vaccine scenario that we emerged, that gives you the total picture that for them life didn't matter, maximization of profit mattered, and stayed away from sharing their patent right with others so that they can protect their profit. So that's a kind of symbol of what the profit maximizing health sector is all about. The other one is charity. Give health charity as a charity, give it to charity. And charity has the problem that the quality cannot be ensured. People who are supposed to be rich, you're not sure because you don't know. There's no accountability, there's no sustainability. That becomes a big problem for that. Government runs many ways, charity programs, gives free healthcare in many countries. At least part of the healthcare is a free health service. Again, it's very inefficient the way they've done. Lots of corruption, lots of deviation from the norm that the government run programs around the world. There are exceptions, of course, but in general, wherever the government healthcare is extremely inefficient and expensive in terms of public money that you spend on it. So we are in a bind. The profit maximization doesn't do the job. Charity model doesn't do the job. Government model, most of the time, it didn't work out the way it should have been. So there we see, finally, we come out the social business option. That's what we're looking for right now. And all the stories you hear about the Grameen programs, including your Grameen Caledonian Nursing College, you are very much part of it, what we're trying to do. So this is an option that we see, it's a possibility. If you can try it out. Now we are talking about creating social business pharmaceutical company, produce vaccines and produce drugs for people in an affordable way, so that it's not something profit maximizing direction, where in the morning we're discussing the vaccine which cost only 60 cents, sold in the most favorable terms at $10, but 60 cents vaccine. So this is the kind of world of healthcare we are in. So we need a tremendous amount of shaking up to raise the voice and correct the policies, what we need to do, and give it a big try on the social business side, because the other two doesn't work so far. It didn't work so far. So this is the new one. So probably we can take a chance on that one. And luckily, this is not something government has to do. It's individual can do. It's a private enterprises can do. Many foundations, trusts who have been doing the charity program can redesign it as a social business program. So this is another direction that we can take. But it's such a fundamental thing. We cannot walk away from it. That's the whole thing. This is the discussion that you held today relates to that. We cannot just go in a slow motion. Someday it will be done. It's not a question of someday. It's today and now. And the pandemic has given us a good context to get things fixed in a way that it was never done before. And thank you for organizing this session. Thank you.
Brilliant. Thank you, Professor Yunus. Several months ago, Professor Yunus wrote an article called "No Going Back" in the context of the pandemic, and I think what we've seen today are just some brilliant examples of particular initiatives and approaches to what no going back actually means in the context of not only the pandemic, but with respect to healthcare itself. And for that, I would really like to thank our brilliant set of panelists for showing us the way forward in that respect. And we're obviously, as Professor Yunus said, going to be discussing some of these issues further over the next few days in Social Business Day itself, but also into the academia proceedings later in the week. But for now, thanks again to, as I said, to our wonderful set of panelists. It's been a really enlightening and enjoyable session. And for those of you who have much of a day left, enjoy it. For those of you who don't, get a good night's sleep before more hard work tomorrow. Okay?
Thank you.
Thank you very much.
Thank you.
Sir, thank you very much, sir.
Good night. Bye-bye. Good to see you.
Thank you, Dr.
Monica.
Cam Donaldson.
Thank you, Vanessa. Thank you, Cam. Bye-bye. Good night. Good night.
Good
Thank
to see
you,
you
Vanessa.
all. Bye. Bye.
Bye-bye. Bye-bye. Thank you.
Well, thank you, everyone. That was the end of our plenary for the last session of day one, healthcare as a social business in the context of pandemic and the post-pandemic era. So just to give you a recap, what's on for tomorrow, we have a jam-packed day as well. There will be 4 plenary sessions altogether and 2 keynote speeches. The very important keynote speech would be one from Peter Holbrook, the CEO of Social Enterprise UK, and there will be another keynote speech from Narayan Murthy, the founder of Infosys, on entrepreneurship and compassionate capitalism. And I'm just going to say out the plenary sessions for tomorrow. We will have a session from Grameen America's Black Women Entrepreneurship Program, the social business developments in Africa, some examples, the Nobin Entrepreneurs Equity Program, building the rural economy as an independent economy. This is very fantastic because it stemmed from an op-ed that Professor Muhammad Yunus wrote and got critically acclaimed globally. And then we have the first plenary session, which is social business experiences from around the world. So thank you everyone for patiently listening, and hopefully you learned a lot, just like I have, from all these fantastic thought leaders and change agents from all over the world and friends of social business and Professor Muhammad Yunus. Ms. Lamia Murshid, if you would like to say the last word for today before we close off. Lamia, would you like to say the final words for today?
Sorry, I was speaking with my microphone off. Thank you to everyone for joining today. And you want to mention, Shihab, that we've been joined by our friends at the Catholic University in Zimbabwe. They have organized a physical event.
Exactly.
And, happy to see that they have now joined. You can see them in the window there. And I think tomorrow morning we have a little video from them, a video greeting cultural item that we will also play. And we just hope that everyone, we had 5,500 people join us via Facebook today, 600 people join us on the Eventi platform, and 300 people joining via Zoom, on the Zoom webinar today. So a lot of people, and we hope everyone will come back. Please follow our activities on the social media to see what's coming up. Every time you can come in whenever you want to and leave off whenever you want to. But we're here and we're going full steam for the next 5 days till July 2nd. And we urge you to stay with us. Thank you again for coming to Social Business Day, and we'll see you tomorrow. Thank you very much.
Thank you. Good night, everyone.